New school year is underway for many students in our state. Still, more school systems are scheduled to open their doors in the coming weeks.
Yeah, so getting ready for that first day includes complying with the state school vaccine mandates.
Hartford Healthcare's Dr. Stephanie Sudikoff, Chief of Pediatrics at St. Vincent's Medical Center, is here with what you need to know. Good morning, Doctor. Thanks for being here.
Good morning.
Good morning. It's my pleasure.
Of course. So, Dr. Sudikoff, what vaccines are required by the state of Connecticut?
So there's quite an alphabet soup of requirements. The core requirements for K through 12 include the DTP, the HIB, the IPV, the varicella, the MMR, and hepatitis A and B. And then when you hit middle school and high school, you need to be up to date on all of those, and you also need to receive a meningococcal vaccine.
And we understand that it also could be challenging for parents to get that appointment with the family physician. So what are some options when it comes to making sure the child gets those vaccinations?
Sure. So some pharmacies will give the vaccines, but you definitely want to confirm with them that they are able to vaccinate children, because not everybody is. Some local health departments will have vaccine clinics, some urgent care centers. And the state of Connecticut has a Connecticut vaccine program, so if parents dial 211, they will get someone on the line who can help them locate a place that will be convenient for them to go get what they need.
Good advice there. Sounds like there are plenty of options. And Connecticut does allow for vaccine exemptions, but who exactly, doctor, can be exempt?
So the state of Connecticut only allows for medical exemptions, and those will need to be certified by a licensed clinician. And the most common reasons for those exemptions are severe allergies to a component of the vaccine, a severe allergic reaction to a particular vaccine in the past, and any kind of compromised immune system. And that may be a result of a primary diagnosis, or it could be a result of medications, including children receiving chemotherapy for cancer.
President Trump, we know, also recently signed an executive order impacting federal guidelines with vaccine schedules. What is something pediatricians like yourself are advising parents to do?
So the most important thing for parents to know is that there's no new science available. There's nothing to refute the data that we have that shows how safe and effective vaccines are. So what pediatricians want parents to know is to stay the course, to keep up with your immunizations, stay on schedule. And I think most importantly, if parents have questions or concerns, that they really engage in open dialogue with their pediatrician or with another trusted expert.
All right, yeah, you know, doctor, there is a lot of information going around, as you just mentioned, from the administration, from your local physician, from pediatricians. How do we stay on top of this when we're hearing so many different things?
You know, I think the key is to avoid sources like social media and really try and find sources that you can rely on being accurate. I will say the Connecticut Department of Public Health has a wonderful website that has all kinds of information about what's required, and will refer you to scientific sources as well. So I think stick with the trusted experts and not social media, not your neighbors. Stick with the science is probably the best advice that I can offer.
Thank you so much for your time this morning.
Thank you.
It's my pleasure.